Let's continue in our talk of the structures of articulation. We're now going to talk about dentition. So we're going to talk about our teeth. Our teeth play a vital part of the speech and mastication mechanism. So mastication means to chew. So our teeth are located within the alveoli of the maxillae and the mandible. So our teeth have, let's start with the root. First one's the root. The root is hidden in the gum line. The crown is the visible 1/3 portion of the tooth. The enamel, this is the surface of the crown. The dental enamel is an extremely hard surface. You can see the enamel of the tooth here. So the root is contained within the gum line. The crown is this visible 1/3 part of the tooth. The enamel is on top of the crown. It's really hard. It's a really hard surface, and it overlays the dentin. This next layer is called the dentin, and it's the ivory of the tooth. Then the pulp in the very middle, this is the heart of the tooth, and it contains the nerve that supplies the tooth. Then on the inside, this layer here is the cementum, and this is a thin layer of bone and holds the tooth in the socket. So the cementum is this layer of bone that holds it into the gum line. So you can see we've got different types of teeth. This is our upper dental arch, and this is our lower dental arch. They each contain equal numbers of teeth of 4 types. So we have incisors. So we have central incisors here, lateral incisors here on either side. We have the cuspids. The cuspids are also called canine or eye teeth, and they are designed for tearing. So you see the cuspids here, and we've got cuspids on the bottom as well on either side. The bicuspids, we have a first and second bicuspid. These are designed for cutting. And then we have the molars in the back, first, second, and third molars, and these are designed for grinding and pulverizing. Our third molar is typically known as our wisdom tooth. Okay, so let's talk about dental development for a minute. So teeth that come in as when we are babies, these are called deciduous or milk teeth, and they're replaced by permanent teeth that should last us the rest of our life. But the milk teeth, when they first come in, they begin erupting around 5 months of age, and they start pushing through the bone at around 6 to 9 months of age. These teeth are much smaller than adult teeth, and they are fewer in number. So babies have 10 teeth in each arch, whereas the adult arch has 16 in each arch. So as our permanent teeth come in, typically the central incisors come in. Our permanent central incisors emerge first, followed by the lateral incisors. Then the first molars typically emerge at the same time as the cuspids, which is between 15 and 20 months of age. And these second molars, they emerge at the time of a child's second birthday. So you can refer to figure 627 for the age of eruption of teeth, of permanent teeth and deciduous teeth. So here's a picture of, these are the deciduous arches of those baby teeth coming in, and then here's the permanent arches, and you can see the age of eruption of each of these types of teeth. So you can see the 6 to 9 month and the lower teeth here. So take a look at that. Okay, when we close our mouth, the process of bringing our upper and lower teeth together into alignment, this is called occlusion. So occlusion really is just bringing the upper and lower teeth into contact. There are 3 different types of alignment. These are class 1, class 2, and class 3, and these can impact articulation and feeding. So we're going to talk about, we'll discuss each one of these types. So proper occlusion is needed for chewing. So a class 1 occlusion, this is normal orientation of where the upper jaw, the maxillae, and the lower jaw, the mandible, come together. So this is normal orientation of the upper and lower jaws fitting together. A class 1 malocclusion, this would be normal orientation of the molars, so the molars would be connecting together correctly, but abnormal orientation of the incisor teeth. So here you can see a picture of a class 1 occlusion. And so you see the teeth are locking together, and this is a normal orientation. This is a normal bite between the mandible and the maxillae. Now, a class 2 malocclusion, this is where you have a relatively retracted mandible. And so this looks like an overbite. So here's a picture of a class 2 malocclusion. So you see the mandible here is retracted, so it's pulled back. So it looks like the teeth are hanging over in an overbite. This is called a class 2 malocclusion. A class 3 malocclusion, this is a relatively protruded mandible. So the picture that you get for a class 3 malocclusion looks like an underbite. So you see the maxillae is retracted back, so the teeth at the bottom are sticking out in an underbite. So we have class 1, 2, and 3 malocclusions, and just a class 1 occlusion is normal closure. Okay, so that's all we're going to talk about on dentition. Now let's move to the vocal cavities. So remember at the beginning of the last section, we talked about the source filter of articulation, and it depends upon cavities in our throats and mouths to shape acoustic output, so to shape the sound that's made at the level of our vocal folds. So you're going to need to know 4 cavities: the oral cavity, the buccal cavity, the nasal, and pharyngeal cavities. So all of these cavities allow us to shape the sounds. Okay, so here's the nasal cavity, here's the oral cavity, and in the back here is the pharyngeal cavity. Okay, so our oral cavity, The anterior boundary of our oral cavity are our lips. So the front part of our oral cavity is started by our lips. The posterior boundary are the posterior fossal pillars. So do you see back here, see these arches in the back of the mouth? These are the fossal pillars, and these are the posterior boundary of the oral cavity. The superior boundary of the oral cavity are the hard and soft palates. So the hard palate and the velum in the back are the top boundaries. The lower boundary, the inferior boundary, is the tongue. So this is the most significant of the cavities because it undergoes the most change during a speech act. So the structures in the oral cavity are strongly involved in articulation. Now, the buccal cavity, this is just the cavity that's lateral to the oral cavity. So on the sides of the oral cavity, and this includes the space between the teeth and the cheeks. So the lateral boundary are the cheeks. The anterior boundary are the lips. And the posterior boundary are the third molars. Okay, so this is just that little bit of space in between your teeth and your cheeks on either side. This cavity plays a role in oral resonance and high-level consonant production. Okay, your pharyngeal cavity is your throat and the back. There's 3 regions of the pharyngeal cavity, and they are the nasopharynx, so this is the part of the pharyngeal cavity that's behind the nasal cavity. The oropharynx is the part of the pharynx behind the oral cavity, and the laryngopharynx is the part of the pharynx that's behind the larynx. Okay, so when we look at the nasal cavities, the anterior boundary of the nasal cavity are the nostrils. The posterior boundary are the nasal choanae, Choanae, and the inferior boundary, the lower boundary, is the hard palate. So the nasal cavity is lined with mucous membranes, cilia, and blood vessels. And the purpose of our nasal cavity is to warm and humidify air that comes in to help protect our lungs. So there's fine nasal hairs that prevent particles from entering the lower respiratory tract. So the articulatory system depends on 3 really important structures. It depends on the lips, the tongue, and the soft palate. So we know the lips are movement for speech, and it depends on the muscles of the face. And we know the lips are really important in both facial expression and speech. They also have a social, cultural, and aesthetic value.